Doctor, we are live now. You can start.
Okay. So, good evening, all. I welcome you all to the very first webinar organized by Team Cataract Focus Group Yosi. So, since we all know that CCC is very important for a cataract surgeon, so we decided to kickstart the activities with a cataract Chitra competition, CCC. So, this is our current Yosi Governing Council. We have Dr. Devakant Mishra sir as our president, Dr. Sonal Kalia ma'am, our immediate past president, Dr. Karan Bhatia sir, Vice President, Dr. Nilesh Kumar sir is our Secretary, Dr. Aditya Sethi sir, Treasurer, and we have Dr. Prasanna Ramesh sir as our Joint Secretary. And we have a team of 20 executive members in the Governing Council. So this is the Cataract Focus Yosi group. Along with me, we have Dr. Aishwarya, Dr. Anoop Singh, Dr. Muhammad Abrar, Dr. Nishi, and Dr. Soumya P in the group. So along with me today, Dr. Anujit Paul and Dr. Aishwarya Rathod will be moderating the session, and we have got an extremely distinguished panel of judges. So let me introduce the judges one by one to all of you. We have Dr. Sonal Kalia ma'am. She is our immediate past president of Yosi, and she's an associate professor at SMS Jaipur. She is a gold medalist and a renowned anterior segment surgeon. She is also an ex-executive member of JOS and executive member of ROS. She has received multiple awards like Young Achiever Award at a Global Conclave of Women Ophthalmological Society. She has also received the Best Surgical Video and Best Poster Award at JOS IIRSI. She was also the organizing secretary at state level glaucoma PG teaching program, for which she was awarded Dakshita Praman Patra. I welcome you, ma'am. We have Dr. Deepak Mishra, sir. Sir needs no introduction. He is an associate professor at Banaras Hindu University. He has received multiple awards, including 15 gold medals. He is an author of 7 national and multiple international books. He has 85 articles published in various journals. He has also participated in 8 national and 2 international research and drug trials. Sir is the chairman scientific committee at UPSOS. He is also the joint secretary for ISMSICS. He is the honorary secretary of Varanasi Ophthalmic Society and a member of AIOS ARC and council member of SAO. We are privileged to have you with us, sir. We have Dr. Pranita Sahai ma'am, who has done her MD from RPC AIMS. She is an assistant professor at GNEC MAMC. She is an executive member of Delhi Ophthalmological Society, and she has 88 PubMed Index publications. She has also received the Best Scientific Paper Award in Keracon 2018 and ISCURUS 2019. She was also the convener of Surgical Skills Transfer course at AIOC 2023 and 24. We welcome you, ma'am. So we have a special presentation delivered by Dr. Prasanna Ramesh sir. He is the Joint Secretary for Yosi, and he is the Research Director and Glaucoma Head at Mahatma Eye Hospital, Trichy. He is also the DNB FAT examiner, also the coordinator and thesis guide in DNB programs. He has published 180 articles in various PubMed Index journals. He has delivered 477 scientific presentations, and he is also one of the editorial board members in IGO. He is also the management committee member for Tamil Nadu Ophthalmic Association. He has won multiple awards at various national and international platforms. So sir will give a presentation on how to capture and catalog imaging. So stay tuned for this for sir's presentation. We welcome you, sir. So let me just briefly explain all the rules. So for the competition, we had asked a maximum of 2 images from each participant. Some have submitted 2 images and some have submitted 1. So each image will be judged separately. The image is there is an interesting caption with the image, and the participants will be given less than 45 seconds to describe the image. Exceeding the time will deduct their marks. So let's begin with the competition. Are we ready?
Yes.
Yeah.
We'll begin with the competition, and the candidates are in the alphabetical order as given in the flyer. So to start the competition, our first candidate for the day is Dr. Anoop Kumar Singh. He is currently working as a senior consultant at ASGI Hospital in Varanasi. This is the first image submitted by him. Dr. Anoop, you have 45 seconds to describe your image, and your time starts now.
We have Dr. Anoop with us. Okay, he had sent me a description, so let me just. So the first picture is everybody needs a superhero to rescue. It is a smartphone photography directly from slit lamp microscope showing a flat DMD and quiet eye, or it could have been a sign of help during or post cataract surgery.
Okay. So this was the second image submitted by Dr.
So
Aman.
I request all the judges to score the image and the description as well as the caption. So this is the second image by Dr. Anoop Singh, Rays of Distress. It is also a smartphone photography directly from slit lamp showing the weak extended zonules in subluxated lens, appearing like a ray of light from sun.
Any comments or questions from any of the three judges on either of the two images?
I
You're
think
welcome now.
Dr. Anoop is not here. So let's
Okay, so we'll
move
move
to
on
the
to the
next
second
participant.
candidate for the day. Dr. Aditya Nath, she is a junior resident at Guru Nanak Eye Center, Delhi, and this was the image submitted by her. Dr. Aditya, you have 45 seconds and your time starts now.
Ma'am, this is a slit lamp examination picture of a 46-year-old female who is a housewife, came with complaints of both the diminution of vision for the last 10 years. Symptoms increases during night and dark, and she also gives history of glare and halos on bright light. On examination, both the vision was 6/24 with no further improvement on refraction, and slit lamp examination showed a well-defined whitish opacity located centrally on the back of the lens adjacent to posterior capsule. It typically has a dense plaque-like appearance that can be seen clearly on slit lamp evaluation, suggestive of a posterior polar cataract.
Any comments or questions from the judges?
Dr. Aditya, any other method in which you could have documented this posterior polar cataract, which can be done on the slit lamp?
Ma'am, retroillumination.
Any other illumination method?
Ma'am, retroillumination.
Okay, thank you. Thank you.
Thank you, ma'am.
So we'll move on to the
Just
next candidate.
I request all the participants to please switch on their video.
Dr. Amanjot Kaur, she was an ex-consultant at LVTI and she's currently a consultant at LGI Institute in Punjab. This is the image submitted by her. Dr. Amanjot, you have 45 seconds to describe your image and your time starts now. Do we have her with us?
No, I think she's not there.
Not there.
Okay. So
ideally should be marking candidates who are not there.
Yes, ma'am. I mean,
I think we can
I
come
think
back.
they should be eligible for the award if they are
Not
not
there
there
present.
themselves. That's what I think. I don't know what the other judges feel.
I mean, it is a.
Well, this could have been
it is
just
up to the
a prediction
judges.
in which, people could have just submitted the images and we could have marked them and sent the results, right? This was
It is a judge's call. I mean, all the judges can decide this. All are not
candidate is
there.
not there, they should lose 10 marks or something.
Okay.
Because they are not here, either they should not be marked. If they are there, then only they should be marked. That's what I feel. I don't know what the others feel. What do you think, Pranita and Deepak?
Ma'am, we can separately mark them absent and we can take a call later on. We can mark them absent on the side.
No. One thing is that what are the rules you set to them before the presentation?
So, sir, they
we
had
had
to be
specifically
present in the
mentioned.
webinar and they had to describe the image in less than 45 seconds. Their presence was necessary.
So you cannot give them award.
No.
You can
Exactly.
take.
We can skip.
I think we can skip this and move on to the next.
This was the second image submitted by her. We'll skip this and move on to the next candidate. Dr. Aparna Bose is here.
Yes, ma'am, I'm here.
Okay. So she is currently pursuing her long-term fellowship in phacoemulsification and medical retina from ASGI Hospital, Kolkata. This was the image submitted by her. You have 45 seconds to describe your image and your time starts now.
So I've captioned this image, Disneyland inside the eye. This is a still from an iPhone surgical video recording. I was reviewing my video at 0.5x in slow motion. Then I realized that the leading haptic along with the optic of the isopure IOL resembles the face of a Mickey Mouse. So that is why I've submitted this image as Disneyland inside the eye.
Any comments or questions from the judges?
No comments, but it's a nice idea having a
Thank you,
Disneyland.
Mom. Thank you, Mom.
So we'll move on to the second image submitted by her. Can you please describe this image in less than 45 seconds?
So this image I've captioned as the IOL's personal hammock. This is an ASOCT image which demonstrates a collection of hyperreflective material between the IOL and the posterior capsule. This is a case of capsular back distension syndrome, and the IOL seems to rest upon this collection. It resembled like a hammock to me, so I've captioned it as the IOL's personal hammock. Also, a capsular excess of less than 5 mm predisposes to this condition. So there was no better picture than this to represent in CCC. So this is it.
Do we have any questions or comments?
A very, very good capture, I should say.
Both are good images.
Thank you, sir. Thank you, ma'am.
Okay. We'll move on to the next candidate, Dr. Bhakti Pase. She's currently an assistant professor at Srimati Kashibai Naval Medical College and General Hospital, Pune. This was the image submitted by her. Ma'am, you have 45 seconds to describe your image, starting now. Dr. Bhakti, are you here?
Doctor,
Sorry, I was unmuted. Good evening, everyone. This is an image taken with the help of a iPhone 11 on a slit lamp directly. It shows the presence of a posterior subcapsular cataract. It is very interesting to see that this posterior subcapsular cataract is in the shape of a heart. Hence, it is labeled as love lies in the eyes of the beholder. Thank you.
Any questions or comments?
No, we move to the next one.
Okay. This was the second image submitted by ma'am. Ma'am, please describe this image in 45 seconds.
Presenting to you a slit lamp photograph taken with iPhone 11. Image here focuses on the superior subconjunctival space. To our surprise, we have here an unusual visitor. That is a posterior chamber intraocular lens. This image is of an over-enthusiastic grandmother who was hit by the fist of her grandson on day 10 of an uneventful small incision cataract surgery, resulting in traumatic dislocation of the intraocular lens through the tunnel into the subconjunctival space. So the image, the title here just indicates you are valued if you are at the right place. Thank you.
Okay. So I guess we'll move on to the next candidate. So the next image that we have has been jointly submitted by Dr. Reenal Pandit, who's a consultant in glaucoma services at Chitra Netralaya, Indore, and Dr. Dipanshu Agarwal, who's also a consultant at the same institute. These four images were submitted as a joint image by both the consultants, and a note to the judges that this should be scored as a single image. Ma'am and sir, your time starts now to describe this image.
Good evening, everyone. So for today's competition, we present to you our composite image, which is the evil magnet. So we have described different case scenarios where the intraocular lenses unfortunately collect sticky souvenirs, such as microvacuoles producing glistenings in the image A, some bad salts producing total opacification of the IOL in image B, pseudo exfoliation flakes shown in the image C, and lastly, silicone oil droplets shown in the image D. Each of these invaders are clinging onto the surface of the IOL persistently, converting a crystal clear view into a blurry battlefield. So this image is a reminder of the fact that sometimes even the intraocular lenses can end up into some sticky situations. That's all. Thank you.
You've described a lot of stuff and a lot of photographs in very short time. So congratulations for wonderful captures and really explaining them beautifully.
Thank you, ma'am.
What is the treatment you plan for this glistening IOLs?
So this glistening IOL was unfortunately also a subluxated one, so we had planned IOL explantation. For the opacified IOL as well, explantation, pseudo exfoliation, it was in the periphery, so no management was required, and these droplets were also not come in the visual axis, so again there was no nothing, it was left untouched.
Okay, good.
So we'll move on to the next candidate, Dr. Harshal Sahare. He's a consultant in vitreoretina, UVA and ROP services at Agarwal's Eye Hospital. Dr. Harshal, the time to start describing your image starts now.
Thank you, ma'am. A 54-year-old gentleman presented with total retinal detachment on right eye and underwent plasma vitrectomy with silicone oil tamponade. A image is a slit lamp examination shown a subcapsular posterior cataract with diffuse oil droplet pattern on retroillumination. Upon further follow-up, following the removal of silicone oil and post-operative air tamponade, the slit lamp examination indicated a reduction in the oil droplets on retroillumination that suggests evanescent cataract. Thank you.
We can move to next one.
Do we have Dr. Juhi with us?
Yeah.
Okay, she is a postgraduate PG year 2 resident. She is at ESIC Medical College and Hospital, Faridabad. So, please, Dr. Juhi, describe your picture.
This is a slit lamp examination photograph clicked by my phone, showing a late complication of cataract surgery resulting in anterior capsular fibrosis along with phimosis of the continuous curvilinear capsular axis post cataract removal. The patient was managed by ND YAG relaxing cuts of anterior capsulotomy. The caption says, "In a world that worships perfection, I chase the beauty of complications."
What was the age of this patient?
65 years.
Nice capture. Nice capture here.
Thank you, Mom.
Dr. Yeah.
Moving on to Dr. Leena. Do we have Dr. Leena with us? Dr. Leena?
No, she's not on the chat right now.
So I think we can move on to the next participant, Dr. Mamta.
Dr. Mamta, are you there?
Dr. Mamta had joined. Dr. Mamta?
Okay, we'll move on. We'll move on to the next participant, no problem.
Dr. Mosmi, ma'am?
Yeah, I'm here.
Yes.
So Dr. Mosmi ma'am has done her MD from RP Center. She has more than 55 publications in peer-reviewed journals. So let's have the image of Dr. So you can describe the image, ma'am.
Hello everyone. So this is an anterior segment photography which is captured with a handheld mobile phone. So it's a 22-year-old male who presented with bilateral partially absorbed cataracts and accompanied by an anterior capsular opening. So there was no history of trauma or prior ocular surgery. We hypothesize that this may be a sequelae of anterior lenticonus. So the large anterior capsular opening here, which represents the grand opening, which is snatching the immunoprivileged honor of the lens. So here these are the pictures of the right eye and these are the pictures of the left eye. On retroillumination, we can see the very well demarcated anterior capsular opening. Thank you.
Wonderful, ma'am. Any questions from the judges?
Very nice picture, Moshmi. Any systemic association that the patient had?
Oh, ma'am, we had checked the patient for any renal or sensory neural hearing loss also. The patient did not have, but the patient had some joint deformities. However, it did not turn out to be anything significant.
Okay.
So, it was interesting.
Okay.
So this is the second image by ma'am. Yeah.
So this is, I have titled it a flating guest because this is known as a feathery cataract, which occurs in a gas-filled eye following vitrectomy. And it's a transient posterior subcapsular cataract, which appears because of disrupted metabolic exchanges between the lens and the aqueous. So the interesting part is the cataract will dissolve on its own within a few days and requires no intervention. Since it's like a transient visitor on the journey of a vitrectomized eye, I have named it flating guest, and it has also been captured with a handheld mobile camera. Thank you.
She's always been very good in what she says and what she writes. So what a nice title that she's given, Fleeting Guest.
Which camera you use, Dr. Mosmi?
Ma'am, sir, only iPhone 11 I have, so I just use that.
So we'll have to iPhone 11 now, sir.
Better. Better to take the help of Mosmi and send patient to her. iPhone 11.
So now it's iPhone 14. I think it has already come out. So I think that will be better.
Okay. Thank you.
Thank you.
Next, we have is Dr. Megha Ji. She is currently working as a consultant in glaucoma services at Irvine Eye Hospital, Salem. So this is the image submitted by Dr. Megha. Please go ahead.
Hello, am I audible?
Yes,
you
you are audible.
Yes.
Yeah, so I've titled my image as Bubble Trouble. So just like the similar picture, like how the previous person had presented, this is an image of a cataract which is caused by gas bubbles entrapped inside a lens after past panavitrectomy with C3F8 injection was given. This patient presented at 1 week post-op with vision of hand movements. So, and then with an intraocular pressure of 36. So we diagnosed it as acute phacomorphic glaucoma, and then the patient had to, we gave anti-glaucoma medications and immediate cataract extraction. So since this is caused by gas bubbles inside, so I've now named it as bubble trouble.
Okay.
The second image. Yeah, so this is second image, I've titled it as Crumpled But Not Forgotten, A Bag's Journey Through Pseudo Exfoliation. So this is a image of a crumpled bag behind a pseudophakia, wherein the bag is looking like a wing of a butterfly, and it's indicating the journey of pseudo exfoliation. Even after a successful cataract surgery, we cannot stay quiet. So we need to keep the patients under follow-up for a long time.
Okay. We can move to next one.
Next, we have is
Dr.
Dr. Nikita. She's a third year PG resident from Gandhi Medical College, Bhopal.
Good evening, ma'am. This is the image of slit lamp image of a developmental cataract. A 15-year-old girl came with chief complaints of diminution of vision from past 6 months. Her vision was 660, both eyes. On examination, Y-shaped lenticular opacity was noted. Her posterior segment was within normal limits. On refraction, her best corrected visual acuity improved to 6.9 with a spherical lens correction of -1.5.
Okay, great. Do we have any questions from the judges?
No questions.
No.
We can move.
Please describe your second Chitra.
Ma'am, this is the image of IOL dislocation following cataract surgery. As we can see that the lens appears decentered. The patient's main complaint was of double vision. This image illustrates the critical importance of secure lens placement during surgeries. Thank you, ma'am.
Nikita, you have taken images from slit lamp.
Yes, sir. From slit lamp image from iPhone 13.
Okay. Thank you.
So the next candidate for the day is Dr. Pravin Kumar Singh. He's a phaco-refractive fellow at ASGI Hospital in Varanasi. He's done it under the mentorship of Dr. Pratyush Ranjan. This is the first image. Please describe the results, sir.
Good evening, everybody. So this is an image captured on a slit lamp on a smartphone. This was a 16-year-old female patient, came with a history of trauma. So on examination, we found this image. So we named this image as a coffee bean cataract. It just resembles like a coffee bean.
Lovely. So all of you are now eating coffees in OT2.
Very nice capture. Nice, looking very pretty. The image is looking very nice.
We'll move on to the second image submitted.
This was a image captured on a middle-aged female patient. She came with a complaint of diminution of vision in her right eye. So on dilated examination over the slit lamp on a smart phone, we found it this cataract. So we named it as a bug in eye. I basically named it as a bug in eye, but my mentor sir told no, it's a cotton candy. So sir told okay, jo tumhara man wo wala naam rakh do.
Good.
So the next candidate for the day is Dr. Purva Srivastava. She's a fellow in phaco emulsification and medical retina at ASG Bhopal. Please describe the image.
Good evening, ma'am. So this was a middle-aged patient who came to us with a complaint of diplopia, was operated elsewhere for cataract, and while examining, we observed that he had a broken IOL, which he wasn't aware of. There wasn't any history of trauma or any other intervention. So we subsequently took him up for a lens exchange, and post the lens exchange, he gained back his vision, and his diplopia was also gone. Broken IOL inside the eye without any known cause.
Any
Maybe
questions or
this
comments?
was implanted and like during implantation earlier itself it was broken. How much time after his cataract surgery did he?
Ma'am, he was operated around 6 months ago elsewhere, and then when he came to us, he told us that he's having diplopia. So in this while, just a few months after the surgery, he started having this diplopia. And then when he came to us, it was already 6 months post his surgery. And there
Any
wasn't any history of
history of
no,
yak
ma'am.
capsulotomy?
No, ma'am. He didn't give it to us. Any intervention, any trauma, nothing.
Okay.
Very strange.
Moving on to your second image.
This was a 11-year-old kid coming to us with a lamellar cataract, and the riders were also captured in this one. So we took him for lens aspiration and IOL implantation subsequently, which he gained useful vision.
Moving on to the next candidate, Dr. Sameer Chaudhary. He is an executive member of Yosi for 2024-2026. He has over 20 publications in peer-reviewed journals and is also a reviewer for international journals. This is the image submitted. Please describe your image, sir. Do we have Dr.
Good
Sameer with
evening.
us?
Yes. A very good evening. So my first image, a waxing gibbous moon, subluxated cataract with zonular laxity. So this is a slit lamp photograph depicting a subluxated cataractus lens with zonular laxity and a microsphere of achia component. The appearance resembles what is called a waxing gibbous moon. The term waxing means increasing and the term gibbous means humped back. The terms are used for a phase of the moon called waxing gibbous because the surface area of the moon that is seen is increasing and the shape of the lit up part of the moon looks like a humpback. The punctate cataractus opacities and the serrations at the equator due to the zonular insertions mimic the uneven cratered surface of the moon.
Very nice thought, Dr. Sameer, and nicely captured image.
Thank you, ma'am.
Moving on to the second image.
So my second image, pseudo-exfoliative blizzard, frosted zonules with phakic shiver. So this was an image which was taken with a smartphone. So this image shows fibrillary white fluffy pseudo-exfoliative material which is seen over the zonules of Zin and the cataractus lens. The resultant considerable zonular weakness has resulted in inferior subluxation of the lens with gross phacodonosis. The phacodonosis and the white pseudo-exfoliative material over the zonules gives the appearance of a lens that is shivering in frosty conditions. Thank you.
Very beautifully captured.
Yes.
Thank you, ma'am. Thank you.
Great job.
Thank you.
Moving on to the next candidate, Dr. Suganya. She is a medical consultant and surgeon at Arvind Eye Hospital, Chennai. This is the image. Please describe your image in 45 seconds.
Good evening. Tied with a bow, developmental cataract. This is a smartphone-based slit lamp image showing an interestingly peculiar presentation of the cataract in a ribbon-like pattern tied with a bow appearance in a 20-year-old moon. Next. My next image is Jingle All the Way Christmas Tree Cataract. This is also a smartphone-based slit lamp image showing polychromatic and highly reflective needle-shaped opacities in the lens of a 69-year-old man. Christmas tree cataract is typically idiopathic and associated with myotonic dystrophy. The most common cause is that it's because the cause for the polychromatic needle-shaped opacities is because of accelerated protein breakdown due to elevated calcium level. Thank you.
Any questions or comments for either of the images?
I think we can move to the next one.
So the next candidate for the day is Dr. Sindhuja Devi. She's doing finishing her comprehensive fellowship at Arvind Eye Hospital in Salem. This is the first image. Please describe your image, Dr. Sindhu.
Good evening, everyone. I have titled my image as I am Mom's Child. This image was taken by VivoFold from retro illumination of the slit lamp. This is a lenticonus appearance on slit lamp examination showing an anterior dimple or oil droplet sign in a female with X-linked Alport syndrome due to mutation of the collagen 4. Which encodes for collagen 4A5 gene. The oil droplet is also obvious on the direct ophthalmoscopy. She also has a symptoms of hematuria. So we have sent her for further investigation for nephrology and for peripherals. We have sent her slide peripheral smear slide.
Moving on to the next image.
This is a endonuclear. This is also taken from the smartphone-based slit lamp image. It's an endonucleus appearing like a sliced lemon with a sutural component. This is a nuclear sclerotic cataract.
I hope your image is not edited in any way. It's really actually like a lemon.
Thank you.
Moving on to the
Yes,
next candidate.
Dr. Anujit to introduce Dr. Utkarsha, please.
Yeah, thank you. Dr. Utkarsha, are you there?
Yes, sir.
Okay,
Good
great.
evening to all.
Yes, so Dr. Utkarsha has done her MS from MKP Salve Institute and pursued fellowship in Neurophthal in Arvinda Hospital, and she's currently working as a senior fellow in Cataract and Purva at Shankara Hospital, Karnataka. So your 45 seconds starts now.
Yeah, so my first image, it is the image of a 68-year-old female who had underwent cataract surgery 4 to 5 years back, and she complained of diminution of vision. So on her best corrected visual acuity was 6.6, but uncorrected was 6.36. So on dilatation, we can see there is a posterior capsular opacification. So it resembled like the snowflake. So the caption, it is snowing.
Right, that's very well described. What device did you use to take the photo?
It's a slit lamp imaging, sir. Top.
Lamp engine and a smartphone camera.
Yes, yes.
All right. Judges, would you like to add anything?
Very nicely documented. Nice image. That has
Thank you,
been.
ma'am.
Okay.
Thank you so much, ma'am.
Right. Okay.
So yeah, my next image is a image of a 21-year-old male who presented in the OPD with an accidental history of trauma while hammering. His best corrected visual acuity was 6.36. On examination, we can see his left eye revealed presence of anterior capsular cataract as well as traumatic posterior capsular cataract. And you can also see a streak of hemorrhage inferiorly. So the cataract resembled a spider cobweb on retro illumination. So, so I captioned it as a cobweb cataract.
Right. That's a very nice image. Any trauma to the posterior segment in such a case?
So no, the posterior segment did not show any history of trauma.
Okay.
Fundus examination was fine, and peripheries were also fine.
Great, great. Judges, would you like to add anything?
No. Lovely images. We can move to the next one.
Right.
Thank
So, Dr. Vidyashri, are you there?
Yes,
Yes,
sir.
I can see you. Great. So Dr. Vidyashri completed her MS from Bangalore Medical College, followed by her fellowship in Cataract and IOL from Shankara Hospital, and she's currently working at the Eye Foundation in Tripur, Tamil Nadu, and she is an artist, photographer, and clinician. So you have 45 seconds to describe your image.
Yes, sir. So this is a slit lamp image of a lady who presented to us who was operated for cataract elsewhere. She presented to us with mild diminution of vision, and when we examined her under slit lamp, it was observed that there was a small chunk of cortical matter over the IOL, and that appeared to me like a brain section of a brain with the elevations and depressions like the gyri and sulcus. So I captioned this image as a brain in the eye. The patient was taken for AC wash and she was doing post-operatively well. And this is mainly to emphasize the importance of cortical wash during the cataract surgery. Thank you.
Right. How many days
Good.
post-op was
Yeah,
this?
how much time post-op was this photograph taken?
Ma'am, post-op was 4 months old. Like she was operated elsewhere, and she 4 months ago, and she came to us for complaints.
Right.
Right. Okay. Okay. Fine. Thank you so much. We'll move on to the next person. Dr. Yash Gal completed his MS in Opthal from MGM Institute of Health Sciences, Navi Mumbai, followed by his fellowship in cornea, cataract, and refractive from Shankar Eye Hospital, and then joined as a consultant in ASG Jamshedpur. He also has numerous credits to his accolades. And now, can you show the image? Yes. Dr. Yash, are you there?
Yeah.
Yeah. So you have 45 seconds.
Yeah. So this was an image of a 60-year-old male who had presented with us, who had undergone cataract surgery 8 months back elsewhere. So this is a slit lamp photography captured on my iPhone 13. So on examination, as we can see, there's an IOL fracture at the center with PCO all around. So my title for this image, Pyramid of Giza in Sands of Sahara, as it describes, probably it's a hydrophilic IOL, so probably the plunger which has come out of the sleeves has hit right in the center while injecting the IOL, which has caused this fracture of 20 to 30% cut in the center. And the 8 months itself has given the sands all around us, which defines my image name, Sands of Sahara. So luckily, as we see it in the center, there was no complaints from the patient, and patient was happy with his best corrected visual acuity. That's the best part of it, with such a pyramid in the center.
I think you captioned it really well. And other than the PCO and that piece in the middle, I think it's a very well done cataract surgery with around CCC and everything.
Yes.
So a slightly unlucky surgeon over there. Judges, would you like to add something?
No, rightly
Lovely
said,
picture.
Ranjit. I think it's an unlucky surgeon.
Okay, surgeon, that's the only takeaway.
But surgeon is lucky in a way. Straightforward cataract surgery with a well-centered IOL, also people complain. I think he didn't complain at all. So there was no need of any IOL explantation followed by a re-implantation.
That's actually a good way of putting it.
Thank
Right.
you.
Thank you, Yash. Thank you. Can we move on? I think
So that is the last candidate for
Last.
the day.
So
excellent.
we have Dr. Leena with us. Can you display Dr. Leena's images?
Okay, just 1 second.
So, yeah. So, can you just put the slide before that so that I can just introduce Dr. Leena Mariam Varghese? She's an associate professor in Department of Ophthalmology at the Believers Church Medical College in Kerala. Ma'am, you can go ahead and describe your image. You have 45 seconds. Dr. Leena, are you there? Yes, you're there. Can you unmute yourself?
Can you see me?
Yes.
Yes.
Yeah. Can you see?
Yeah, please describe your image in 45 seconds, ma'm. We can see
Yeah.
you, can't hear you.
Okay. Good evening, all. So this is basically a patient who came for routine checkup post cataract surgery. He has done his cataract surgery elsewhere. He came to me around 10 years later just for a diabetic retinopathy checkup. So when I dilated, this is what I see. I see a L-shaped pearl hanging from the anterior capsule downwards. And actually, I could take a video where I could see the pearl moving. It was practically a dancing pearl that I could see. Since the vision was not affected, there was nothing I had to do for the patient. It was just a sparkle in the eye that I could see.
Right, ma'am. Thank you so much. Is there anyone in the chat box who
Dr.
has
Mamta has joined in, I think.
Mamta has joined? Great. So, Dr. Mamta, can you unmute yourself and switch on your camera? In the meantime, we'll just show your... Yes. So, Dr. Mamta is a PG resident from PGIMS Rohtak, and you have 45 seconds to describe your image. You can begin. Dr. Mamta? Yeah, you can, you're muted. You can unmute yourself. Dr. Mamta, am I audible? I can see you. Dr. Mamta, are you there? So, is there anyone else who has joined in? Yes, Mamta, you have to unmute yourself. I think we lost her. Dr. Lippi, is there anyone else, or else we can move on?
No, Dr. Anoop and Dr. Amanjot have not received the call. So
Okay. So I think,
ma'am, we should consider Dr. Mamta. I mean, I don't know why.
I think she's not being able to log in, or
Yes, we can consider her. We will give marks to him. Her. Okay.
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 So with that, that brings us to an end of the.
Mamta's just message that she's not able to unmute herself. I don't know, there's some technical glitch that she's.
So can you give her image once more? I'll just read it out so that everyone can have a look and she can get a fair chance.
And finally, Dr. Anoop and Dr. Amanjot had not joined, right? Or they had joined?
No, Dr. Amanjot and Dr. Anoop have not joined, although Dr. Anoop has messaged me the descriptions of the images, saying that in case he's not able to join, please read out the description. So I read it out. Should we consider that? Or
Laptop? Yeah, it's the laptop. Yeah, take the laptop.
Dr. Leena, please,
Ma'am, can
please
you
unmute yourself, Dr. Leena.
So I'll just describe this image. Someone has to help me out with the title, but I'll just go ahead with the description. A 34-year-old carpenter presented in a tertiary care center with a penetrating blade injury while working with a 2 mm metal foreign body in the posterior segment. A corneal tear repair was done with pars plana vitrectomy and foreign body removal was done. Patient presented with traumatic cataract, which with hand movement vision close to face and intraocular pressure was 32 in the affected eye. He was managed promptly with cataract extraction, anterior vitrectomy, and PCL implantation with a final visual outcome of 624. I think that's a very nice story with a very good ending. Once again, if someone can help us with this title.
I'll help you, Anaji. दिल नजर पर अगर नजर रखते ये हादसा नहीं होता. Hope I'm okay.
Oh
How
my God.
cute that Prasanna is the one who's
South Indian reading out Hindi title.
Shame on me.
ये हादसा नहीं होता. Hope that was fine.
Anujit, you are in Kolkata and you're asking Prasanna to read out. Wow.
What a turn of events this evening. Anyway, thank you so much, Dr. Mamta. I think this is a very interesting photo with a very interesting description. So yes, I deserve -10 for that. So with that, we'll move on to the second segment of the evening. And we
before that, I request all the judges to please share the marks with me so that I can compile all of them.
Yes. So we'll move on to our photo taker extraordinaire among the YO as well as the national circuit, Dr. Prasanna Venkatesh. So he will be trying to help us out with how to capture and catalog imaging for us plebeians to understand how we can go ahead, how we can improve ourselves. Over to you, Dr. Prasanna, sir.
Yeah. Thank you, Anuji. Thank you, Lippi, and the whole Cataract team, and the whole team Yosi who's behind this particular webinar. So how to catalog and capture imaging? I'll try to stick to anterior segment as much as possible, but I'll try to add few tips and tricks for posterior segment as well. So this is just one of the methods. This is not the only method. So each one of us will be having our own methods, and that's how our journey in imaging starts, right? And so this is one of my 10 to go methods. So I'm also an iPhone user, and you see the 700 rupee adapter that you can see. So again, this is what I started doing it, and this is the practice that we are doing it in our clinic as well. And you can see the video-based module that I use for capturing imaging. I do take photographs, but predominantly I also do videographs as well. And this was one of my videos on YAG PI. I'm just showing this here because I think everything that you actually get in imaging, you can actually get in videos as well. And then even a simple video like a YAG PI is one which I started my journey with. It is one of the very tougher videos to shoot. You won't find many videos on it, but you can see whatever we actually tend to see, right? You can see again the photo description, the spark photo description that you can see here when I'm hitting it with the laser mark. A simple procedure like YAG PA. See how the air bubbles are actually coming in. So before YAG PA, you don't see the air bubbles. After YAG PA, you see the air bubbles which goes on top. So all these small things. So I'm fond of teaching, and when you want to really teach the core, I feel videos are one of the better ways. And with videos, you can start your imaging journey. Videos are more tougher. Once you start with videos, and then maybe you can even crop your videos and you may get a lot of images from your videos. That is another way to start your journey. And you did see me enlarging the spot size and demonstrating Van Erich's again at the ending. And again, this is another without an Abraham lens. The previous one was with an Abraham lens. And in this, I wanted to even capture photo disruption. You can see this is slow motion. You can even hear the sound, my dear friends. I'm just playing it once again. You can see this is photo description. So photo description is something that we always feel we can't see, right? But even as an image, if you want to even take photo description as a photograph, right? See, this is the photograph that I have captured in my iPhone in photo description. So you just need to use the slow motion, and this is photo description for you right in your eyes. And again, I also recently did this one. So this was one of my post-suture cat patients who had ifema, and I followed up this particular patient, and then we can see that the ifema resolved, but the fibrin membrane was in the visual axis. So when I lyse the fibrin membrane with my YAG, you can see again here in this particular video, I went ahead and I shot the video of it. So only with videos, you will get different frames. Okay. There are many frames that an iPhone might give. You may make your video into an image, or you may end up capturing your own photographs. That's up to you. This is one of the tips and tricks which has really worked well for me, and I thought I should share this here. And you can see here even the minimal ifema as well as the minimal fibrin membrane that I'm just clearing it from the visual axis. So it will help you in teaching your residents as well, your fellows as well, and also in going to the next level of imaging. And cataloging your imaging, my dear friends, you need to build your style, tell your story, and maybe collaging it, or you mean editing it. You can label it however way you want. Make it ethical so that you can see on the right hand side, it's a geometric paradox. So we would not be having the ultimate gonioscopy machine where you get 360 degrees, but when we do a gonioscopy and when we take different angles, right, you can make sure it is aesthetic visual in your visual axis, or when you see it. So you can see the four quadrants and you have made it as a geometric paradox or a geometric square. And then this is another image acquisition, as I told you, right? If you want to take your video journey instead of a photograph journey, again, I'm just deviating a bit, but this is one that really works well for me, at least in my hands. You can see again, this is a post-trabeculectomy patient, MMC bleb. The left-hand side, I'm showing the anterior chamber angle, which is anterior chamber, which is very deep. And on the right-hand side, again, you can see this is an image, the fluorescent staining that I do with a cobalt blue. So anything that looks aesthetic to you, you can just make sure you start clicking. So this is a cobalt blue. It looks like a coral reef, right? And see the end image on the right, my dear friends. So this is how the left-hand side is what you see me doing, or this is what I'm actually thinking when I'm trying to take that image. And on the right-hand side, you can see I've taken that in a diffuse illumination in slit lamp, then followed by a cobalt blue with staining. So that gives you that coral reef kind of a picture. And that gives you the complete elevation of that aesthetic, bleb looking aesthetic. It is just an MMC bleb, which was 30 years old post MMC. And then I've just collaged it with anterior segment OCT as well as sheen plug imaging on the right. So this is the brain behind going into making these images. And let's see some more examples on the left as well as on the right. I'll try to, skip maybe posterior segment because that's not the order of the day. But collaging, again, I recommend this POTO. I did see Dr. Reenal and Dr. Dipanshu. having a collage. It was a very well done collage. So mainly when you are collaging your images, one challenge that I faced is the image when you captured will be in high definition. But when you want to, collage your images without high definition, this was one app that I really crossed my journey, which really helped me to aesthetically collage. So this was called POTO, where you can see me. This is the recording that I have done. So you can see how I'm actually collaging the Gonio images to, bring it aesthetically. You can even use your hands. This is a photo app where you can actually collage. You can see me. I'm just moving my fingers up and down, and I'm selecting the frames exactly the way I want to. And this really helps for iPhone users. And finally, you get the aesthetic geometric paradox in Gunyu, as well as on the left-hand side. You can see I'm just moving it fast forward for want of time, but I wanted it to keep it unedited so that, you would know how I am doing it. So finally, the output comes the way it comes. And finally, when you organize your collage, again, you can see again, this is a simple YAG PI. I'm just showing a story. So you need to show a story when it comes to imaging. You can see I've done a PA on top, then I have recorded the Gonio after the PA was done, maybe in the review. And then post 10 days when he came, I dilated, and you can see that there was a small, very Sinike kind of a thing, the subacute angle closure in the image alphabet E that you can see. So this is the story that you can take even in simple cases like YAG PA. Again, annotate your images, especially after presenting in a competition like this. Go for publication, don't stop it here. And annotating is very important. Use arrows where needed, use asterisks wherever needed. Don't use arrows everywhere, because sometimes that may alone not work and it may not do the justice to your images. Again, avoid annotations when the image is self-explanatory. So this was one of my World Glaucoma Congress images in top 10 in 2021, and I published it in IGO later. You can see it's a simple ectropion UVA with sheen plug imaging and the gonioscopy of the same. It is just uh, aligned in such a way that the story is self-explanatory and you don't need to, annotate these images. Again, if you are having a follow-up, even when you are presenting in competitions, maybe for the young ophthalmologists who are watching it, this is a very simple image of a foreign body, my dear friends. The foreign body was removed, and then how the healing happened, how the epithelialization happened, but I just used sheen plug imaging to document the same. But you can see me, what I've done here is I've aligned the collage here. You can see, right? I've aligned the collage in such a way that, your eyes goes to that particular region where you need to see the cornea epithelialization that is taking place along with the mid-stroma. It was slightly a mid-stroma foreign body. So you can see how it is healing. And again, deviating a bit, this is a posterior segment imaging. So this was on my plate. So this was one of the FFA images where you can see that I don't have a montage. So the collage was there for me to make. So this was how I make my collages. There is no hard, no secret to it. So if you don't have your collage, or if you don't have your montage, or if you don't have your mosaic view, as Edon calls it, you can still do your own imaging. So many journals nowadays, or whenever you go for a competition, again, this is me. You can see again in this particular section, this case, supposed to be segment FFA. FFA, many of us will not be having our own montage camera. Those are very costly. So you can make your own. You just need to follow the vessel pattern here, and you need to make your collages. And again, coming on to the end, always moving on to the last segment, publish your images again. You need to catalog your images. What is that you want and how you want to present it. And these are some of my award-winning images. I'm just sharing it here in AACRS 2022. You can see anterior segment as well as posterior segment. And all of these, most of it are smartphone. And this is AACRS 2023 and this is AACRS 2024. You can see some of these images here. I'm just pointing my arrow. This is a decimal membrane detachment where I've used anterior segment imaging tools to capture it. This is a fibrin membrane on the right. In ACRS, we have a special section called After Effects, where you are allowed to, even edit your images. You can see a flower in the shape of a pupil or with an iris on the left-hand side top. And then these are some of the images in other competitions. I'm just quickly sharing it to you. So always make sure the images that you capture, anterior segment, posterior segment, the frame that you're going to select, even it can be a simple bullet that you can see again in this particular section. a simple bulle. It was a bullous keratopathy that I'm just showing here. Again, below it is it's a fistula. So you can always have your own frame, but the right frame, capturing it the right way. Even a simple Sturge-Weber patient here, the lone vessel that you can see here, the anterior segment that I'm showing here, the lone wolf. I labeled it as a lone wolf. And again, on the fundus on the right hand side, you can see an heart-shaped PPA. One of the presenters did have an heart-shaped one. And I think there is no end to it. And on the right hand side, you can see a dragon's eye that I presented where there was a circular rhexis. And when I was doing this particular case, I had a weak side port in my early days where both the sides went for an iris prolapse. You can see it went to a iris prolapse and it mimicked an eye within the eye that you can see here. So the images are always in front of us. The inspirations are always in front of us. And on the left hand side, you can see a Christmas tree cataract on the left again. So there is no limit, my dear friends. And these are all some of my publications that I have published from academy. You can see this is one of the images where the tube was placed in a sulcus for an axonful Rieger syndrome, published in the American Academy of Ophthalmology. And from IJO, Kerala Journal, and all my regional journals, I've extensively published all my images. I strongly recommend all the young ophthalmologists here to not stop your images only with your competition. Make sure you publish it. And these arrows that you can see, these are my images, the ocular surface squamous neoplasia, the lone wolf that I told you. A picture can speak 1,000 words, my dear friends. So make sure you publish your images. Simple markings that you use. You can see here a posterior embryotoxon with an anterior peripheral anterior synechae where it goes and attaches to the posterior embryotoxon. Make sure you align it. So that is the key here. And then use your concept. I'm just keeping the posterior segment slides. This is one of my Urate-Zavalia syndrome, which I published, where again, capturing your images. All of these were captured in the iPhone, the stent generation 1. And you can see the Urate-Zavalia, the dilated pupil here. It's shot on a smartphone camera. And this is one of my scenarios in lockdown when there was not much availability of, donor scleras. I used the Gore-Tex to, when there was a few overfiltration cases, our being a training institute where we did have a training during lockdown. So you can see during flap-related complications, we use Gore-Tex. And there is one of this particular cases on the right-hand side bottom, we had one fistula formation where how the fistula formation, you can see the ASOCT and the sheen flux, how the fistula healed. We were thinking whether we needed to, go and revise it. See how the fistula healed. I have put an asterisk here and see the fistula here, how it's going in for scarring. So we didn't need to intervene. This is before the scarring. So after 6 months, we followed it up. So anterior segment imaging, there is much more to explore. Start your phone, go for ASOCT, anterior, and this is a simple striate keratopathy. So, which I wanted to, really explore how a striate keratopathy or a foreign body. These are simple imaging, but you get a lot of detailed information. And we coined the term optical blooming, and where you can see how the iritis as well as the striate keratopathy, it's healing, which is all we always tend to imagine these things. And again, on the right-hand side, you can see we use sheen flux imaging to monitor the same. So you can keep an n number of catalogs. For want of time, I'll close it here. So this is a keratic precipitate, a granulomatous keratic precipitate patient where you can see again slit lamp imaging. We showed a zoomed imaging, and all of these are publications, my dear friends. I feel each one of you who presented this, go for the publications, and you can see the gonioscopy of the same followed by extensive anterior segment imaging. And this is capsular phimosis, and this was an optic crack in one of my patients who I had when I used a Hoya lens in an Alcon D cartridge because of the lens, Hoya has a preloaded one which came out because the patient tilted his head. I loaded this lens in a Alcon D cartridge because I didn't want to extend the incision, and I had a crack. And again, that was one I wanted to publish my complications. So see, it appears to look like as if it's a worm in the eye, but no, this is a crack in the optic mid-periphery. So keep publishing it. So I hope every one of you, so always rejections are the way forward, and I'll not take much time. And these are some of my other images where digitally we have generated, or it's rather calling the digital drawing, where in 2022, if you had seen the cover image in AOS that was contributed by myself, where the digitally also you can draw your images. It's just like your painting, but you'll have to digitally, draw your images. So this was one. If you are looking at ASCRS or APAO, they have their own category called After Effects, where these kind of images are of high demand if you are thinking of going and presenting your images abroad. So this is my last one, which I presented in Dehradun. And the kid in you, just keep it going. So this was one IFEMA, and this was one coloboma, and this was one of the congenital cataracts, which I captured with Anterion, which I had the chance to present last month in Dehradun. And I have founded my own company as well called the Center of Moving Images. And my fond of imaging has taken me far, and I founded my own imaging company. It's a startup, and thank you once again to the whole Yosi team. I can see one of the former president Sonal Maam, as well as the whole governing council, Dr. Lippi, Anujit, for this opportunity to share my whole talk on imaging. And I've shared all my experience in the last 7 years, and all of the images were mine. And thank you once again for the opportunity for this talk. Thank you.
Thank you so much, sir. I think your second last image actually sums your entire presentation. After seeing your presentation, it looks like the eye itself is a galaxy and we are just one observer. And it's only you who's taken every corner of the galaxy in photos and shared it with us in just 10 minutes. With that, I'd like to hand over the mic to all the judges. Deepak Mishra, sir, could you please share your thoughts on the competition as well as the presentation, sir?
First, regarding the presentation, it's always wonderful. Prasanna is one of my favorite Yosi team member as a presenter. Whenever I got the opportunity to listen him, I never missed. That is my inner thought I'm sharing with all of you. And as for the presentation is concerned, every figure, every one presented so well that it's not possible to describe. Anyone, maybe 2 or 3 or 5 of you got some little bit more score and be on the top 3 or top 5. But for me, it's truly everyone is the winner today. And it's best thing that Yosi is going in a right way, in a such a way that they are giving opportunity what they are supposed to be. That is the beauty of the Yosi team, that they are giving the opportunity for the youngs and in all the different ways. I have seen lot of journeys of Sonal or another Karan, everyone, and all of them are so much dedicated at each and every time they came with new thoughts, and they actually not only came, they implemented it. Whatever they thought, they apply it and get it more and more, Yosi. Thank you everyone for including me, and hope, as Prasanna already mentioned, all of you must try for the publication of your images. Nowadays, you have lot of journals, even in IGO you can submit, and don't afraid of the rejection. It will, you may fail to get published someone, but in another journal, repeated, you can go anywhere. The sky is the limit. And 3 cheers to big team, the new team of the Yosi. Congratulations, Nilesh too, for becoming the secretary. I am from all of everyone. Thank you, everyone. Thank you.
Thank you so much, sir.
Nilesh is also there.
Yes. Nilesha, would you like to say a few words?
I think first the judges that
Sonal ma'am, I just hand over the mic to you.
Let Pranita speak first, please.
Okay, ma'am.
Thank you, Team Yosi, for including me for this wonderful session and beautiful images that we have seen. Sir has already summarized that all the presentations and pictures were so really nice. And I don't know why did you exclude Prasanna from the competition. If he would have participated, no one would have had the opportunity to win. And a wonderful talk, Prasanna, and that's one of the best videos of
Thank you, ma'am.
adapters for getting our iPhones attached to the slit lamp soon so that we can buy the same. And thank you, Team Yosi. Congratulations for the wonderful webinar.
Thank you, ma'am. Ma'am, I would also like to acknowledge Dr. John Davis here. In my initial journeys, I learned most of the imaging from his videos. I was always under the impression when I started in 2017 that imaging is something you need a flashy device or a costly device, but I think the Amazon adapter was something, I think all the viewers here, it's only 700 rupees. And with our smartphones today, I think sky is the limit. Anybody can really uh, do wonders with the pixels that we have in the smartphone. Another thing is the teaching part of it. The one that I showed in YAG-PA or the fibrin membrane. We are now started to attach the phone in the YAG cap and the YAG-PA procedures as well. Sometimes the first year resident may not really understand where to focus the laser or what is photo description or how to do vitriolysis, how to do membranolysis. So when we attach it, like the ENT surgeons who do it with an endoscope and they watch it in a TV. So that's something that we have started in our center. Thank you. Thank you once again, ma'am.
Thank you. Thank you, ma'am. Thank you, sir. Sonal, ma'am.
Yeah, congratulations to the Cataract Focus Group for organizing this very innovative competition. Thank you very much, Deepak Mishra, sir, for finding time from your busy schedule with all the TSTCs and SSTCs. You're still finding time for a small Yosi competition and praising our team. So we're really indebted to you for that. Thank you very much, Dr. Pranita, for finding time for this particular competition. The Cataract Focus Group has done a great job. Some of the suggestions to the team would be that whenever you have a photography competition, the categories that you gave to the judges, the rules also just clarify to the candidates that they need to be present if they are presenting. Otherwise, it could have been just a submission contest. And then, also when the images, they were so beautifully captured, and yet some were standing out in totality and some were standing out as the quality of the image, some were standing out in terms of their description. So, rather than having a first, second, third prize overall, I mean, that's just a thought. Maybe next time you can think of having the best description, the best captured image, and have some maybe, some people were giving collages, some have one or two have given ASOCT pictures also. So I think there should be categories for slit lamp photography captured by the slit lamp, by the smartphone, because the quality and this thing changes, and then ASOCT pictures should be a separate category altogether. These are just thoughts. This was these are not that to say that this was not a well organized competition. It was very well organized, and I'm really thankful to you for the invite, and thankful to Dr. Prasanna for finding time to guide all these people who have enthusiastically captured so many images. Some of them really stood out to me. The images by Mosmi, Sameer, and so many other images that were really, standing out. But I hope the judges' comments are taken in the right spirit by the team as well as the candidates, that none of the people who have, not made it to the first three or whatever they are going to announce has been lacking in any way. Just that there were certain different criteria with which some of the judges would be marking and some would be marking in a different way. That's how competitions go. And everybody has a different way to look at things. So I really want to, applaud the people who have, used their presence of mind. Like, that image with that Mickey Mouse is really, stood out in the beginning. That was a sheer presence of mind, or somebody noticing a small pearl. These are presence of mind moments that, one can just miss when seeing, if it's a very, very busy day. And over to the organizers for the announcement of the prizes, I guess.
Yes. Thank you so much, ma'am. And a huge thank you to all the judges and the participants. I would like to also request Dr. Nilesh, sir. Dr. Nilesh Kumar is the current secretary of Yosi, to please say a few words.
Thank you, Anujit, and congratulations to you and Dr. Lippi. Dr. Lippi took the lead, and for the first, I think, first competition she's organizing, managing to get 35 submissions and like collating them and making them present in an hour. That is a big congratulations to both of you that you managed to complete all those webinars. I logged in thinking that it will be in half, like it will be in midway and I'll join, but I was like, Prasanna's talk is going on. And to answer Pranita's question, ma'am, we have taken a decision in GC that he is banned from all UC competition. Otherwise, he will keep pinning and nobody else can win. So that is a decision that we have taken. So I think Dr. Lippi was taking notes already when Sonal ma'am was telling all those things. We need to improve on that front, and we will definitely take all those comment, and from next time we will have multiple categories and hopefully more like 50, 80 submissions. So there can be a category where those who are not presenting can be judged differently, and those who are presenting will be like have a bigger, better competition or better price, something like that. Thank you, Deepak sir, for taking out time and always supporting UC. He has been a pillar of strength, always supporting UC wherever it is possible. Pratham, thank you for joining UC, giving it support, and always being there whenever we need you to be a speaker, panel judge, wherever we want. You are always there. Thank you so much for that. And thank you, Dr. Prasanna. As always, wonderful talk.
Thank you.
Loved it. And, over to Anujit and Lipi.
Yeah. Thank you so much, sir. I just would like to acknowledge Dr. Aishwarya as well. It's Dr. Aishwarya and Dr.
Yeah.
Lipi who has
Yes.
taken the lead. I was just taking the back seat. With that, I will just hand over the mic to Dr. Lipi for the most exciting part of the webinar. The results.
So first of all, I would like to thank all the judges for taking out their valuable time for us. I would like to thank Dr. Nilesh sir and Dr. Devakant sir for giving me free hands for this webinar and the future webinars. So I would like to thank Dr. Anujit. He agreed and I asked him, since this is my first webinar, so please be there. He was always there, just a call away. I thank Dr. Aishwarya and the whole of the Cataract Focus team. I thank Dr. Prasanna sir. It was the last minute. Sir is always ready for a presentation, and he's always the one who is motivating to do better. And he's like, just go with it, even if it is 10 submissions, because we did not know in the beginning how many submissions we will get, and we got quite a few number of submissions. So regarding the rules to the participants, the rules were made clear. They were personally called and asked to join the webinar also. Still, I think 2 of them have not joined. So I think it could, I have taken down all the points. Thank you for your input, Dr. Sonal ma'am. We will keep all the points in mind from the next time. So it's time to declare the winner. So let me just ask from all of you, any guesses for the third position? Who is the third prize winner?
I think everyone is a little bit
Nobody will take that risk.
Okay, Dr.
Nobody will-
Aishwarya, please share the slide. So the third prize goes to Dr. Reenal and Dr. Dipanshu sir for the IOL Evil Magnet. Congratulations.
Thank you.
Second prize.
Thank you.
So any inputs, Dr. Dipanshu sir, anything you would like to say?
I think already a lot has been said, and very well organized competition. We had compiled this image thinking that if we had put in these images separately, then that would have not made sense. So we thought of compiling it all together, and since 2 images per person were allowed, so maximum of we had put in 4 images for 2 participants and forwarded this image for competition. Thank you for choosing this. Thank you.
Just Dr. Lipi, for next webinar, will this qualify as a single composite image or 4 images? That we also need to figure out.
So sir insisted that it should be taken as a single image only.
Yeah.
So second prize goes to Dr. Maushami Banerjee ma'am for her the fleeting guest, second image. Congratulations, ma'am. Are you there?
Congratulations, ma'am.
Thank you so much. Thank you.
And the one which is the most awaited, the first prize goes to Dr. Sameer Chaudhary. Congratulations, Dr. Sameer.
Thank you for choosing this.
Congratulations.
So thank you all the participants for making this webinar and competition a success. All the winners will be getting their prizes in the next YosiCon, and as promised, the winning image, that is Dr. Sameer's image, will be published in YO Times.
Congratulations.
Dr. Sameer, I would like to ask you to write a small write-up, case detail, and share it with Dr. Lipi for the next YO Times.
Sure, sir. I'll do that. Thank you so much. Thank you.
Congratulations
Thank
for winners and all the participants also. You all really worked hard.
Thank you, ma'am. Thank you.
Thank you. So can Dr. Lipi, can you just unshare your screen and we can all just stop for a small photograph with the Yosi symbol? So I'm just requesting all the participants to please switch on your video cameras. Please give you 10 seconds to do that. And if you can just
Yes.
raise your hand like this and copy me. Look at the screen. I think everyone has done it. All right, everyone smile, please. Just a minute. Right, okay. I think we miss Renal ma'am. Just a minute. Renal ma'am, are you ready? Please do this once again, guys, everyone. Right. Thank you so much. Thank you, everyone. Thank you for this lovely evening. Manjula ma'am, you can stop the live.
Yeah, thank you, everyone. So hoping to meet you all in the next webinar, which is on 26th November on capsulorhexis.
Yeah. And Dr. Samir, invite for tomorrow's webinar as well.
Definitely, sir.
And treat
Tomorrow.
to Yosi team. I think
Excuse me, doctor, shall I stop streaming?
Yeah, yeah.